Make it plain.
Make it plain.
MIP.
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
God bless you. Good morning. Get woke. Ladies and gentlemen, MIP is COVID free. Free meaning you don't need a subscription to hear MIP every day now for a limited time. While we endure this pandemic, we want to make it available to everyone. So wherever you get your podcasts, Apple Podcasts, Spotify, Google Podcasts, Stitcher, Pandora, MIP is COVID free and available to you and everyone without a subscription. Ladies and gentlemen, my guest today is Associate Dean for Diversity and Inclusion and the Chief Diversity Officer at the Ohio State University Wexner Medical Center. He is the President-elect of the National Medical Association. It's an honor to welcome to Make It Plain, Dr. Leon McDougle. Dr. McDougle, how are you?
Doing well, Mark Thompson. Doing very well.
Good. It's a pleasure to have you, sir. I pray that you and yours are faring as best you can in this corona pandemic.
Yes, sheltering in is important. We all have our mask, and so washing hands and really trying to stay away 6 feet apart. And yes, it's a tough time. Yeah,
it is. Congratulations on your new role as president of the National Medical Association. For our audience's sake, share, if you would, a little bit of the history and the difference between the American Medical Association and the National Medical Association.
That's a good question. So, oh Lord. So let's start from the very beginning. So the National Medical Association was established in 1895. Now, interestingly, Mark Thompson, this was the result of, now hear this, in 1870 and 1872, the American Medical Association refused to seat three African-American physicians as members.
Wow.
This is five years after the end of the Civil War.
Wow.
1872, brother.
Mm-hmm.
So, and that led, and the important thing about it was you needed to have association membership to have hospital privileges. You needed to have AMA membership to undergo specialty training. So that refusal of African Americans to join extended all the way to the mid-60s. So, and in 1963, there were 5,000 African American physicians. There were 227,000 European American physicians. So when we talk about these, and others such as Bird and Clayton, and one of my mentors, Rodney Hood, who practices in San Diego, we describe this as the slave health deficit, dating back from the Middle Passage, ongoing through Jim Crow, and the results of what we're seeing now as displayed by this coronavirus pandemic. I didn't know you were going to go that far back. So that's good. That's good.
Yeah, no, we want to break it down. Well, just before we leave that subject, from time, sometimes people argue that in this era, after all, we had a black president. Some people say, do we still need HBCUs? Do we still need black professional organizations? Do we still need an NMA? The current president of the AMA is an African American. I know we still need an NMA, but I want you to make the case to our audience. Why is it important that the NMA still exists and continues to do its work?
So there's a term from Brian Stevenson's most recent book concerning the plight of African Americans on death row, Just Mercy. There's a term in that book that he really emphasizes, Mark Thompson. That term is proximity.
Mm-hmm.
So African Americans that belong to the National Medical Association, we are in proximity to the community. We serve the African American community. We are on the front line of service for our community. And our whole organization is dedicated to supporting such physicians and providing excellent care for African American populations especially. So we're not diffused. We're focused on African American patients and the communities in which they live in, and that's what has led to some of our collaborations with Rainbow Push Coalition and the recent release of the concerns in our communities, from access to screening to treatment and decisions thereafter. So very good question.
Yes, sir. So we know now, we have some information which has revealed that African Americans are being disproportionately affected by this virus, correct?
Yes, yes. And so part of that is at the very beginning. So Mark Thompson, so, say you're sick, you calling into the, so we've actually, in my practice and others, we're doing telehealth visits. So we're communicating via video or telephone with our patients. And then if patients are having respiratory symptoms, we refer them to our call-in center that deals with making the decision whether one will get screened for COVID-19 coronavirus, because there's a scarcity in regards to testing supplies in regards to the nasal swabs and the assays that are needed to test it. So here's the issue, and this is nationwide. So you are asked screening questions to even decide whether or not you will get to that next step as far as the nasal swabs are concerned. So if you don't answer enough questions positively, you fail the test. And what we're seeing nationally is that African Americans aren't passing that test. They're not getting to that, just at the very beginning. They're not getting to that step where people are actually doing the nasal swab to confirm whether one has coronavirus. And what we're advocating in the Public Health Manifesto is that if one is from a under-resourced group, such as African American, Latinx, American Indian, Native American, that you're assigned a priority risk score that will enable you to just get to that first step. Then, okay, let's say you screen positive. So you are given permission to get a nasal swab. Now, what do we know? You look on television every night and you see the SUVs driving up and people getting their nose swab for the COVID-19. What if you don't have a car? So what we're advocating in the National Medical Association and Rainbow Push Coalition is that these drive-up stations should all have the capability to have a walk-up station also. And then that walk-up and drive-up station, they should be no more than 1/4 mile or a 5-minute walk from a functioning bus stop, train station, or subway station. So that's dealing with that initial part, just getting the screening, right? So as there is no cure as we know it now, those initial steps are critical. And then the whole prevention aspect of it. So let's even go a little bit more upstream. We're asking that, especially the African American community, we want you to shelter in place and worship in place, and utilize the technology to communicate, live streaming, and the like. And then when out in public, wear a facial mask. And Mark Thompson, I have another caveat for that. So especially in regards to African American males, I know you've probably been seeing in the media where African American males have been accused or considered a criminal background or thought to be in the store, whatever, like they're going to rob something. We're recommending that to help offset that implicit bias, that racism, that we wear a white or a lighter colored mask, because especially if you have a black mask on and a hoodie, and then all this unconscious bias out there, is just, we're thinking that could lead to an unfavorable outcome for people of color. So we're advising that too, as it pertains to that protection in public, being 6 feet apart, washing your hands, using Thompson. So I'm hearing all these stories about hand sanitizer, and see what was wiped out. No hand sanitizer. However, I turn my head right next to it, whole shelf full of hand washing soap and dispensers and so forth. So, okay, you don't have this hand sanitizer. You're not supposed to be shaking anybody's hand in the first place, but there's plenty of soap out there. So you get that hand washing soap, wash your hands for 20 seconds at least. That's another protective factor.
Yeah. I want to go back for a minute. You mentioned that many African Americans have not been able to get to the next step in the testing process when it comes to the nasal swab. We don't, if I understood you correctly, we don't, we aren't answering the questions that get, what questions are we not answering, or what questions are we asking wrongly? And are others answering questions in a certain way that moves them down the line, it doesn't move us?
And see, that's another good question. They don't really release, these questions aren't really publicly released. And when we do know, however, that based on some of what I've seen, that European Americans are more oftentimes being referred to that next step. Now, that makes you also consider perhaps some implicit bias or some unconscious bias, or bias in general may be involved with that too. So that's why we're really wanting to have a better, that's where data comes in, right?
Right.
So we're talking about data, and we don't have data, and then once the data comes out, what does it show? African Americans are dying more often. African Americans are having higher complications with COVID-19. So that really makes it critical, that data piece, so there can be some oversight into the processes that are going on, so informed adjustments can be made.
Why wouldn't some of these jurisdictions and medical professionals not want the data to be collected? I mean, I don't understand why there would be a resistance to that.
I don't think it's so much people not wanting to do that. I don't think they're really being requested to do that. So at these screening centers and these call-in centers, they're taking calls from all over our city and other cities across the nation. I'm not certain if that's part of the protocol. And if it isn't, it should be, right? It's really a gap in data collection. So I think that may be more of a system issue in regards to that upfront, calling the center, giving them your symptoms and then having someone decide upon whether you go to the next step or not. So that's something that should be implemented. I agree. Yes.
Tell us more about the manifesto that the National Medical Association has entered into with the Rainbow Push Coalition.
Yes, we thought it was time to provide some answers. So many times you hear mostly about how we're dying faster, and that's important. That's good news to have. So we came together to provide some solutions, as I had spoken to earlier, in regards to what does shelter in place mean? What does worship in place mean? Let's focus on our incarcerated population. Mark Thompson, as you see now, this is exploding. This is exploding. We're now starting to pay attention to nursing homes, but the least of these are being ignored. And so you're in this prison cell and aren't afforded the opportunity to have. You have to buy your own soap from the commissary. So we're just basic public health principles during this pandemic need to be enforced and depopulate these cells from overpopulation with non-violent persons, elderly persons, vulnerable to disease. We're advocating that we decompress the overpopulation of these prisons and jails and separate the sick from the well. And it also even affects the staff, the workers, the guards, and they're going into these jails and prisons and maybe transferring that infection back to their loved ones at home and their community. And when we know what we know about jails is transient. You may have people in there for like 3 days. So you're in there for 3 days. You get exposed to someone with COVID-19. You go back home and you infect the community. So we really wanted to place a spotlight and a highlight on that issue in particular. And then Mark Thompson, in discussions, we've even talked about do not resuscitate. So when the governor declares a public health emergency in a state, then the rules for deciding who gets access to scarce resources is governed by the state's public health department with some consultation federally. So, and it was discussed how people may be placed on involuntary do not resuscitate based on the availability of ventilators and medication and the like during a pandemic. So we wanted to bring that to people's attention and as an issue. I'm working on a paper now with a colleague concerning the value of advanced directives like a living will or a durable power of attorney of health, even though the state health department has that more authority to make decisions. We're thinking that having a written document expressing your wishes, that may be your sole advocate, that piece of paper, because people are even being restricted from visiting the hospital due to this high level of infection and uncertainty. So this is a big issue, and we really wanted to come together as two national organizations, Reverend Jesse Jackson, Rainbow Push Coalition, the National Medical Association, and we've also joined with the National Bar Association and really concerned about these jails and prisons and what's going on in Dallas County, Texas, what's going on in Cook County, Illinois, and even here in my own state, Marion County Institutional incarceration facility where there are just high rates of infection with COVID-19 and the need to decompress these prisons and jails so that there can be more likelihood of those persons who are predominantly African American, people of color, have a better chance of surviving.
You mentioned governors. Lastly, I mean, you are a medical professional. Should governors be making decisions about when shelter in place should end without the consultation of medical professionals such as yourself? Such of these governors, we look at a place like Georgia, some cities in the South, some states in the South, where there are large numbers of African Americans. This reopening, taking things back to normal, may be premature, right?
Not maybe, it is premature, and those decisions should be informed by consultation with medical personnel, public health officials who have best interests of the state in mind, as I'm sure the governor does. These decisions have to be informed.
Yeah. That's the responsible thing to do. If anyone listening, Dr. McDougle, as an African American, feels as if they have not been treated appropriately or given the necessary attention during this crisis, or they can't get the help they need, what advice does the NMA have for them?
So I would recommend that they contact either the health system ombudsman. There's typically also a patient experience team that are there to help address concerns of patients who interface with the health system, and also the chief medical officer. Those persons are responsible for ensuring quality of care for a health system or hospital system or a medical center, or even the chief medical officer or CEO of a particular health clinic or federally qualified health center. And also, if one has a personal relationship with a physician, that I would also especially recommend that, and especially members of the National Medical Association. So that's what I would recommend.
My brother, good to see you. Congratulations on being president-elect of the National Medical Association. Appreciate your expertise, and I'm sure we'll be calling on you again as we continue to wade through this crisis, man.
Yes. Mark Thompson, appreciate you. I've followed you. I've seen you on television. You're doing a wonderful job, and just let Michael Peary know, and we can get connected. I'm happy to participate with your wonderful work.
Thank you, sir. God bless you. God bless you, Dr. McDougle.
God bless you also.
All right. Take care, man.
All right. Thank you.
Thank you for listening to Make It Plain and Get Woke. Remember to listen, like, and subscribe on Apple Podcasts, Spotify, and wherever you get your podcasts. If all minds are clear, it has been made plain.